So now, what is it? September 3rd. And I am getting ready to head into Methodist Germantown Hospital to do my pre-op work. I will have surgery, a lumpectomy, or a partial mastectomy is what they call it, next Wednesday, September 10th. And before I do that, I have to have pre-op stuff done. So my understanding is I will have blood work, which I hate doing that because they have such a hard time with my veins. But I'll have blood work done, and I will have an EKG, which will be a first for me. And I'll have a chest x-ray, I think, which will also be a first. So, hit it. Okay, I'm trying to be patient. I went in and I had the blood work done, and luckily that went a little better than it normally does. And then she excused me to leave and go home. Well, luckily I was paying attention when the office manager, or I can't remember what her title is, but my doctor's person the oncologist person who sets the appointment. Luckily I was paying attention when she told me about the pre-op work, instead of me just listening and saying I was gonna go have pre-op work done. I asked specifically what was going to happen, and she said blood work, and she said a chest exam, and she said an EKG. And so when they dismissed me after the blood work, I said, well, what? Because they gave me specific instructions, or she had given me specific instructions on where to go in the hospital. And so after they dismissed me for the blood work, they were like, they didn't know what I was talking about when I said the chest exam and the EKG. And so I asked her to look it up again. She looked it up, and she was like, oh yeah, okay, yeah, you're supposed to have a chest exam, but we don't do this here, and you have to go to the hospital. So I thought I was at the hospital, but I had to go to another building at the hospital. And I went over there, and they did not see the order for the EKG, only the chest exam. And so I was calling my doctor on my way over there, and I didn't doctor's office. I didn't get anybody. So I did get the chest exam, which that was quick and easy, but they still didn't have the order for the EKG. I called the doctor again because I don't have a lot of time to come up here, and so I was trying to get everything done, which is why I came on today, because this was a good day for me to do this stuff. And so still didn't get the doctor. I was on the phone while I was walking to get the x-ray done. Still didn't get the doctor. Finally, after calling again, I got the doctor's office, and she said, oh yeah, I don't know why the order wasn't put in for the EKG. We just put it in. Can you see if they have it? So I walked back up to the counter to see if they have it. A guy was walking up to the counter after I got to the counter, and she reached for his folder to help him first, which that's minor, but my patience is kind of slow right now. And so I just looked as she helped him. And my doctor was on the phone, doctor's office, it wasn't the doctor, waiting to see if the order was in before we got off the phone. So the guy needed to reschedule, and that took longer than I feel like it should have before she was able to see me. Then she said, okay, yes, now we see it in here. The order is in. You can wait in the waiting area. So I walked down the hall to the waiting area. Then I'm there probably 5 minutes, and she comes back to tell me that the department, or whoever does the EKG, they left early today. They left early today, so they couldn't do it. And I could schedule something, which I did, which means I still got to come back up here. All these little things that are a little tough. Plus this eczema is spreading to my neck, and I'm itching all the time now. So I'm just I'm remaining grateful that things are not worse. But here's the journey. And meanwhile, as I'm sitting and waiting, getting more notifications about bills, payment due, and some other appointments that I'm so confused about for my MyChart account, which I thought the username password was saved on my phone, but they're not. I don't remember what they are. So just, all the little things. All right, I'm about to head to work out. I need to get that in.